Very good morning, all of you, and this beautiful Sunday morning. Um, I already, welcome you on behalf of our community. So our today's speaker is Dr. Tanmoy Das. He is senior consultant and head at Department of Anesthesia, Perioperative Medicine and Pain at Apollo Multispecialty Hospital, Kolkata, and he is sharing his insights and talk about physician burnout. Very common topic, but not commonly heard in our fraternity. And this is a silent crisis in healthcare. So he did his MD anesthesiology from SBC Medical College and Hospital, Cuttack, Utkal University, 1991. Um, so after that, he became a lecturer in cardiac anesthesia at LTM Medical College and Hospital until 1993. Since after that, he became associate consultant in cardiac anesthesia um, at BM Birla Heart Research Center till 2000. And then he became a consultant in cardiac anesthesia at Suraksha Hospital until 2003. And since then, he is heading uh, anesthesia at Apollo Multispecialty Hospital, Kolkata. So his area of interest is general, regional, transplant, pediatric, and trauma anesthesia. Apart from being an excellent physician for more than 3 decades, he is a wildlife photographer, a nutritionist, enthusiast, and a health podcaster. So without further ado, I would share the dais to Dr. Tanmoy Das.
Thank you, Dr. Gaurav, for a very kind introduction, and welcome everybody to this meeting today. And this is something we are going to discuss today, which many physicians are affected with, but rarely discussed openly. And let's see how we go about throwing some insight into the topic. And I do have a PowerPoint. I will share it with you just to get a perspective of the whole thing. But once in a while, I may just stop sharing and talk to you directly. Once again, welcome everybody. Now, we all became doctors for a particular reason. All of us had this ideal of helping people, helping our fellow human beings. Some of us got motivated because somebody in the family got affected, and we wanted to become doctors so that we could help others. So when we are young, when we are in our teenage, when we are trying to, plus that time we believe that doctors have a very good social status, and we want to become a doctor. We want to be successful, well placed in society. So whatever the motivations are, they are quite high when we start off. And later on, things do change, and because the moment you join, there is a culture shock, there is a work pressure, there is huge amount of studies, and then you think, what have I landed up into? And that is the beginning of the problem when it starts.
Exactly.
And when we were maybe things were a little different when we were young. I mean, when I belong, well, I don't belong to the dinosaur age, but yes. But today also, but today the problem is even more acute, I believe, among the young residents, as I see.
Yeah.
So let's try and throw some light into it. So I believe burnout is something, before we define it, it begins with stress. Now, stress is something which is very much physiological and which is built in. You must have all read about fight, fright, and flight. And that is a reaction which is built in with us in an evolutionary scale. And it is good at a particular level. But what the problem with us is the chronic stress, I think, and how we react to it. So we know that our lives are fantastically competitive nowadays. And in the modern day life, we are made to join the rat race even from the kindergarten stage. They have to compete, get into an entrance exam, even at nursery. And there is stress in almost everything we do. Growing up is a stress. education is a stress, getting a job is a stress, and as you know, becoming a physician is a very highly stressed job. It is, I would say, an occupational hazard.
Yeah.
So more than being a hazard, the stress will always be there. It all depends on how you deal with it. So why does it happen? To err with human, err is human. You must have heard of this by famous 18th century poet Alexander Pope, and he was reporting on US medical mistakes even that time. But the problem today, the present day working pattern of physicians does not allow for any error, and everything that goes wrong must be somebody's fault. Is what the attitude is nowadays. So we go into the root cause analysis, some compensate whatever, litigation, compensation, and this all adds to the stress. And it does affect the health of the physicians. It could be anything. You can have a look at the slide. It could be this is the effect of chronic stress on physicians on a long term basis, I would say. Fatigue, gastritis, ulcers. I've seen many people suffering from that. Hypertension, arrhythmias. This is not in the residency stage, maybe, but later on. And there could be other health disorders, which I'm not going to go into the detail, but that does have what you say negative repercussions. And it could be behavioral also. Alcohol and drug abuse are much more in physicians. And another problem is physicians have easy access to drugs, so that it is a very potential high potential for misuse. Now, there is a difference between stress and burnout. This is very important to recognize, because like in any relationship, as long as you are quarreling, arguing with your whoever you are having a relationship with, it means you are there, you care for each other. But when it leads to indifference, that is more dangerous, I think. So that is the difference between stress and burnout. If you are overreactive, irritable, it is one thing. But if you are disengaged and numb, your stress has reached a level where you are completely you are emotionally detached, that is when it becomes a problem. So that is where we call it a burnout. And you become, I've seen many people starting out post MD, post MS, as brilliant physicians, brilliant surgeons, and after a couple of years they just lose the motivation for many reasons, which is entirely not their own fault, because of the system, because of the surroundings, because of so many reasons which I'm going to discuss. So this is the thing. This indifference, when it comes in, it is such a sad thing to happen, because it is completely shatters. Not only shatters, it is a it's something very difficult, and people don't talk about it. So these are the risk factors. Number one is work overload. Work overload is always there for doctors, but it is how much each person is exposed to. So if you are not recognized, I'm sorry, but I'm in the department room today, so people will be coming and going.
That's okay, sir. That's okay.
So,
We understand.
so if you are not recognized for your whatever you are doing, either in your colleagues and by your seniors or by the hospital management, just lack of professional recognition is can demotivate a doctor anytime. And if you are not having a happy, harmonious relationship with your colleagues, most of us are in a very competitive environment. So each person thinks that I must you know be one up on the other person. So that can also have a negative repercussion, and it can be a chronic source of stress, and can lead to burnout in the long run. And sometimes things are not under your control, even if you are for example, if you are a surgeon working in a corporate hospital, and you ask for certain things, they are not there. You may not have your best of instruments or everything available, and you may not get the proper time of allocation of your operating room, and so many other things. You are not in full control. And the management or the people who are running the hospital may interfere with your choice of whatever decisions you make, whether it is a thing or an instrument, or it is your way of doing things, or your manpower. So these are the things which expose you to risk of chronic stress and burnout. So it might manifest in symptoms. It might be physical, like fatigue, sleep disorders, headache, and GI disorders; psychological, behavioral, and when it reaches a later stage, you can be demotivated to an extent of being absent for no reason at all. And in your personal life also, it can hamper your communication. So all these things are symptoms, but they need to be recognized. That is the issue. So the whole problem as such is not a new one. It has been known since 1960s, and this has been defined as a physical and emotional response to occupational stress. And physicians have always been at high risk for burnout. But the problem is now the problem has multiplied. It has been always there, and always a part of literature, I would say, but not really experienced and talked about. So the consequences can be both on a personal level and on a professional level. Personal level, you might land up in getting depressed, having problems with your relationships, and alcohol and substance abuse. I already talked about, and I've seen suicide ideations also when a person is really burnt out. I remember losing someone I know, so that has been a very traumatic experience. And at the professional level, it can affect your professionalism, I would say. It can affect the good skilled trained doctor you are. So if you are not satisfied, and at one particular stage you become less productive. So, and this is a concept borrowed from Mayo Clinic. This can
Yeah.
vitiate your entire working atmosphere. It becomes a vicious cycle, and one thing can lead to the other. And this, if you land up in a hospital in this particular circumstance, everybody suffers. Nobody gains from this. If there is a blame culture, especially, it tends to happen. And and instead of trying to find out what went wrong, it could be just a systems error. And every time something goes wrong, if somebody is blamed, then it can be devastating for the person who is blamed. And that person, even he might clam up and not talk about it anymore, and that can lead to even more adverse effects on the entire system. And ultimately, who suffers? It is the patient. So, and that also kind of reverses back. So what is the problem is physician burnout. It has been there, but it is now increasing. Why it is increasing? Because doctors are now losing autonomy. Whether once upon a time, the GP, the doctor practicing in the neighborhood, that was one of the best things. But that is fast eroding with all upcoming hospitals, and the GP practice is almost gone nowadays. Even patients want to see the highest possible specialist, even the smallest of problems. So that connection between a doctor and a patient is no longer there. And when you work in a hospital, you are no longer in charge. It is the administrator who is in charge. So a doctor in charge model to an administrator model. So that keeps you even more stressed. And what we are seeing now is because of the various standards that we follow, like the NABH or the Joint Commission, which our hospital follows. So electronic health records have becoming more and more popular. Not popular, I would say, being enforced. Our hospital, for example, they're working towards a paperless hospital. So the problem is, most of the time, doctors are busy entering records, entering electronic health records. So everything is computerized. So that kind of dehumanizes the patient. Connection is gone. Not only that, a lot of time is have to be kept aside for entering into the records, and that could uh, take away the time from actually taking care of the patient. So that is an added cause of stress. That is not very much prevalent in our country, but definitely in Western countries. Gaurav, you must have seen that
Yeah, yeah, yeah,
it is a huge time-taking thing. So the whole perspective is that we doctors are the frontline people. We ultimately bear take the responsibility for the outcomes in our patients, but the control is not there with us. So this is a cause of stress, and this is a an increasing cause of burnout. And you know what is happening in our country now? Our social position is no longer very good, and I've taken this from the link which you shared a couple of days back. And
yeah,
the problem lies not with the doctor. The problem lies with the infrastructure. We do have a good doctor-patient ratio compared to the WHO standard, but thanks to the lack of infrastructure, most doctors would are in the urban areas, and it affects the. I don't know what happens. I'm not going to the details of the topic. This is a full discussion what is happening in our country today, but putting it in the perspective of burnout, this is has been a huge added stress and burnout in the recent years, even before the pandemic. And in the pandemic, it has become even more. And this has resulted in a situation where doctors who are already there, they don't want to continue doing what they are doing. And people who are the best of students don't want to do medicine anymore. So that is very, very tragic. So, okay. So let's come back to you mentioned burnout. This is just a concept which I'm going to introduce, but I'll quickly go through it. It's like a bank, you should have a bank of energy. So your energy can be both mental, physical, emotional, and spiritual. So what the time that you take rest, you recharge, you connect with your family and your loved ones, it builds up the energy bank. But when you work, it kinds of depletes because of the stress of the situation. So you dip into a negative energy balance. And if you remember this concept, you will immediately recognize when I am going there. That's why this concept is I'm introducing. So you keep spending. The problem is when you are going towards a burnout, you don't replenish as much. So what happens initially, if you are in the okay zone, you are working fine, and you don't go into the burnout zone, you will experience a little bit of stress every day. That is fine. That is physiological, and that keeps you going, keeps you motivated. You're doing a surgery, you're doing a good anesthetizing a good case, you're seeing a good patient in a critical care unit or wherever, and that is your motivation. That is what we doctors are made for. And we treat a patient, we treat them well, they become well, and no matter a little bit of concern is there when we are operating or anesthetizing. So that is fine. But what happens is uh, it becomes too much, and from you have to say from one transplant a day, if you are doing two or three, because the work is more, or number of patients go up and things go out of control, so you may go into the burnout zone one or two once or twice or in a day. But then the next stage is you're in the burnout zone most of the time. And if it continues, you may be in the burnout zone and not replenishing your energy. You don't have time at home, you don't have time to meet up your friends, and that becomes an issue. And then you might be going into the danger zone where you become indifferent. I have to do, chalo karna hi hai, let us do it. You become mechanical in your work. So that is when things around you and patients also might suffer. And then if you completely go into the burnout zone, and that is where it is known as a complete physician burnout. So seeing these graphs, you might try and identify which zone individual each of you are, and just remembering them that okay, I'm getting burnt out, I'm getting, it is becoming too much. This may help you to step back a little bit. So yes, it begins right in the medical, in the when you join the medical college. Someone mentioned in our group that no one talks about medical students. So yeah, I said I would bring up this point. So what happens when a student joins is there is a dramatic change in lifestyle, and they have multiple postings, sleep deprivation, and they have to study and work at the same time. So it can be a kind of a culture shock. It can be a kind of added stress and strain. So that is when, well, most of us got used to it, and we were proud of our being able to balance both. And but I believe the stress is much more nowadays with a lot of other factors involved. So it's yet it starts in the medical days itself, and as I said, it is an occupational hazard. So we are basically dealing with sick and scared and dying people and their families, and work takes away most of our energy. So this is there, but it all depends on how you deal with it. Most of us did very well, I would say, and we have seen in my so many years of experience that most doctors learn how to cope with this particular way of living, way of doing. But it is only recently that it is, I think, becoming a bigger problem. I'll discuss why. The cause number two is the specific job that you have. Being a physician itself is the cause of stress, no doubt, cause of burnout, cause of increased concern. But a specific job, I will talk about anesthesia. That's me, by the way, in the operating room, long back in a liver transplant patient. Um, so I say that anesthesia is the science which makes surgery safe, feasible, and possible. And all the developments in surgery has taken place after anesthesia has developed, but at a price, because anesthesiology is a stressful specialty
Yeah.
because of its of being completely responsible for a person's life. And uh, I'm I'm sure, Dr. Gaurav, you when you operate, you don't have to bother about the head end. You don't have to
Agree.
bother about the anything else. Just you
Yeah.
can operate safely.
Yeah.
It has been made possible, but there is always the stress of something going wrong, something happening to the patient, because patients might be very sick. So that adds to the stress. I'm sure every specialty has its own stress. Surgery, critical care, and emergency, neuro care, everything. All of the specialties have their stress built in. So that once if you and the problem is we are not taught how to deal with this. We are taught the clinical medicine, diagnosis, treatment, and how to save lives every given moment. But we are not taught how to deal with this. What is the other cause of burnout? Let me show this. You must have heard of the term elephant in the room. So this is something known as gorilla in your life. Imagine sharing your life with a 200 kg gorilla, and that is your career for for most doctors like us today. And that is a huge thing to balance with your family life. We are not taught balancing our family life. And this gorilla, if you live with a gorilla, he will occupy your entire house, and you will be squished to a very small corner. So that balance you need to achieve. And the otherwise this gorilla will take over and tip the balance. So not having so we are not, as I said, we are not taught these balancing skills. So we learn and practice, and we keep on adjusting. We ignore our physical, emotional, and spiritual needs. And you know that you can't go on long any longer, but you keep on continuing. That is when the problem comes. And it might lead to conflicts at the home front, and that adds to the problem. So, and another problem with our we doctors are, we are kind of conditioned when we are trained medically in our medical education, that to be a workaholic. If there is a problem, we'll have work harder, we'll study harder. So these are the same traits which make successful physicians, and but it actually sets us up for a burnout down the road. That is what we don't realize. So either we are workaholics or we are superheroes. Some of us are perfectionists. And all these qualities is what is at a particular stage makes us brilliant, makes us toppers, and that actually might set us up for a problem later on. So that this has to be so this is adding to the whole condition. And there are certain indoctrinations that we get, that patient comes first and never show weakness. If I asked you, how are you, even if in a very bad day, most of us knee-jerk reaction is, I'm fine, I'm fine, dude, nothing wrong with me, I can go on. So I've seen this happen when this is not true. So I'm seeing this happen even with my residents, my juniors. And when I realize this, I call them and have a 1:1 talk with them. What's really wrong with this and all that. So another problem is, and if you are unfortunate enough to have a bad boss, in the management world, they say that people don't quit companies; they quit their bosses, and it is true for physicians too. And if you are unlucky enough, most teachers, professors, I would say, are good and they help their student. But there might be a few cases like this. So that can add to your burnout stress. So basically, burnout is a constellation of all these symptoms. So maybe you can deny it, you continue working, but you're not the same doctor when you were when you started out with ideals. So some people are, they just go on something known as a survival mode. So you are just a shadow of your previous self. So how can we stop it? So that is the problem. Let's see. The very first thing I would say is to recognize the problem. If you are in denial, most of us do, that is not going to help. So and then we must realize that something, this is not right. I'm being overworked. I'm being overstressed. My family is suffering. They are, I have seen some doctors very proudly saying that I've seen my children grow up horizontally. I mean, one day my son has grown up and left home. So partly it has happened to me also. But that is not a thing to be proud of.
Agree.
At the end of the day, if you stop working, your hospital will replace you within a few days, but your family will miss you forever. So that importance and realization must be there. And that first comes recognition that I am overworking. And as if going through that energy diagram, we have two options. One is to decrease the energy expenditure, and the other one is to build up or recharge your batteries, I would say. So your physical, mental energy in that model. So it has to be a multi-pronged approach. Multi-pronged approach means it starts with an individual approach. The family has a very big role to play. Your co-workers, or if you are not in a hospital, in a department, or in a department, if you are in it's a very important way to work together. And a hospital or institution where you are employed plays a very big role. So let's see one by one what we can. First of all, in an individual level, it's very, very important. It is the stress and the burnout. Individually, you must be able to recognize and deal, because you are, I would say to everyone, that you are the most important person in your life. You must give attention to yourself. You must realize what is going on and accept the problem. So it is not the situation, it is the reaction to the situation. I've seen many people react or adapt to stress very well. I know surgeons, my colleagues, anesthesiologists, they have adapted, and they deal so well with the stressful situations that it is a great, they are great examples to learn from. But you must have that emotional maturity, the knowledge, the experience that comes with it. And most important thing, you must learn that if I'm burning out, I must know how to delegate and share the responsibility. That is where I think department comes in. I'll talk about it at the department level. I would say, let me stop sharing for a while because the slides are not there. Let me talk to you directly. So,
Yeah.
how many of you work as a department, and how many of you work together as a group? That makes a lot of difference, because we realized this long back. I have joined this hospital 20 years back, and we started forming the department of anesthesia, or the group. Initially it was a group practice like any private hospital, but we realized that just coming, anesthetizing and going, and that will just keep on piling up, and we will never be a coherent group. So we thought of having a group first and then a department later, with academics included, so that it becomes a proper, just like a medical college, but in a proper corporate private setting. And we kind of share responsibilities. When we work as a group, we have kind of paid holidays. You can go on holidays without being bothered about your compensation. You can, the moment the person is stressed out, we say they take a few days off. We give proper leaves to our group, so that we help each other, work as a department, work as a family. So that reduces the stress a lot, especially in a high stress work like anesthesia, where we by default work around the clock. Ours is a 24 hours department. So, and we have to make sure that each person gets proper rest, gets de-stressed, and that is only then they can function and give their best. So that is one thing, and that builds up our camaraderie together. So I this is something which everyone can apply to their life, even if you are a practicing physician and just having a clinic on your own. You can form a team, you can form a group, I think. And in our hospital, it is the aim of the even the higher management that every department should work as a group, so that it helps everybody. But what I have seen is sometimes the sense of competitiveness prevents people from working as a group. So that I think is something which we can work around. In the long run, what really matters is how well adjusted you are to the situation, not how competitive you are. So that is what I think. So uh, this is one of the ways to deal with the burnout and stress. So let me see if I can give you some tools about it. Share once again. Yeah. So that is the individual level thing which I was talking about. Yeah. So one particular tool is having a calendar. Now this is a tool which has been suggested. I use the calendar a lot, but most people I've seen, they don't have a calendar. There is no place in the calendar for things other than work. Maybe you have an appointment of your patients, and this many patients, 20 patients, 4 surgeries, but hardly any space for your spouse, your children, whether you want to work out or whatever. So just remember one thing, that anything which is not in the calendar is never going to get done. So put everything in the calendar. Maybe might not do it, but and carry it with you. And this is one way to deal with that 200 kilo gorilla. So keep a big bucket list. All of us have a bucket list, things that I must do before I die. Do not keep too many things into it because it might overwhelm you, but go through it at regular intervals. And once again, remember that if it's not in your bucket list, it will never get done. If somebody wants to travel somewhere, want to take a holiday, so prioritize that list and say that one particular stage, I will do it. So this is maybe when you are a resident, this may not apply because that is when you want to advance your career. But once you are in a career and you must perform, to in order to perform, we tend to forget that there are things which life is much more than what we are doing. So it is not only the gorilla, it is also, you have to kind of, I will say, from a photographer's perspective, that you need to zoom out and see life. And so most of us are so focused that we only see a small thing in a macro form. But we need to zoom out once in a while and see from above, and that is when we realize that there is so many things. And by the time realize, it should can be too late. So you do things once in a while, and keep a weekly bucket list also. So if you want to have time with your children, want to work out, want to have a dinner with your friend, so these things also matter a lot. So these things, unless you put it on a list, you may not get it done. So, and another big thing is keep a work-life boundary. So keep your work at your workplace. Most of us, I have seen many doctors going home and constantly taking calls round the clock nowadays on WhatsApp also. So we must ask ourselves whether it is really worth it. They do not have a off switch, so it goes on 24 hours. So that can easily lead to a burnout. So work is important. I agree, work, but your other life is also very, very important. So there must be a clear boundary to prevent that. And I cannot overstress the importance of family. Family is not only a stress buster, it is your support system, it is your shock absorber, and we all know the importance of family. And it includes pets also, because nothing can distress you more than your pets. I'm a dog lover. I have plenty of, I do spend plenty of time, and the purity of love, unconditional love you want to experience, I always say, it is from your pets, it is from who loves you. Nobody will love you as unconditionally as even if you return home after midnight, he or she is waiting for you. So that is very, very, and it distresses you like anything. You had a very bad day, and if you spend some time with your pet, and it really helps. So on a personal level, how do I prevent stress being in anesthesia, being in head of the department? So this is what I do. I really mentally prepare myself. I, like Sherlock Holmes has a mind palace, so where he imagines what is going to happen beforehand, try to detect. So I have a mind palace. I go into the mind palace and I mentally prepare for the next day. I know my patients and lists. I plan meticulously for difficult cases. And not only that, I tell my colleagues, somebody, I might need your help. So please, if you, and we always help out. We are 15 operating rooms. Something goes wrong in one room, all of us are there. So, and I follow checklists, very, very important. And I maintain a very high degree of communication with entire staff, entire theater staff and surgeons. So that helps to reduce last minute hiccups, and that helps me to do my cases smoothly. How many of you use background music at your area of work, especially in the operating room, Dr. Gaurav? Yes, we do all do.
Yes, yes.
And not only that, I ask my patients what kind of music you like just before induction. And there are papers which has been published, which shows that the music helps reduce the drug dose during induction of anesthesia. Did you
Oh,
know that?
no.
Yes, they have done a comparative study, and they found that if the patient is relaxed and especially listening to the music that they like, it can reduce the drug, the dose of the propofol or whatever drug we use during induction. So that is a very interesting, and which I have done and myself and seen. It really helps, and even hemodynamic parameters are better if I have that kind of music going on. So the you can dig up those studies. So, and at the end of the day, I make my principle, one principle I follow. I am not going to take back work home. So that is where my team concepts help. So I stay back that extra hour, finish my reading, writing work or whatever. I have some admin work to do as the head of the department. I allocate I think responsibilities for the next day. I make sure my patients are doing fine, and I do some creative tasks also. That is whatever. That is my in between cases. I might do something totally different, like processing a photograph. So that really chills me out, and then only I leave for the day. So that, and when I once I go home, thanks to the teamwork that I have, I don't have to bother about taking calls. So these are my stress busters, which are in general, I would say. I'm not very much into meditation and yoga, to admit. Mind is not yet settled for that, but I do I do a lot of reading. I do some amount of exercise because it is very important. And once upon a time, I didn't have even time, didn't have enough time for exercise. I thought it was okay. Let's go. But I 10 years back, I was becoming sicker. Becoming obese, becoming other metabolic issues. So then I realized that this is not really worth it. And that is another part of my story. Maybe we'll discuss some other time how I realized that metabolic health issues are a part of our stress response that we have, part of burnout. And medicines, save lives every day, Gaurav. We
Yeah.
are we are God at acute care. We're like gods now. But as far as chronic medical diseases are concerned, I think modern mainstream medicine has missed the bus, because despite of all these technological advances, the incidence of diabetes, hypertension, obesity, heart attacks, it's so sad seeing young Indians drop dead every day. We have we are completely barking up the wrong tree, including cancer. So that is my realization, and then I went into it, read about it, and then got out of it. That is another story. So I do a lot of reading. I love music like everyone does. But I that time de-stressed. I found my calling in photography. That is a story in itself, and that is my. What is important to realize is about stress busters more than just relaxing, listening to music, and doing nothing. If you do something creative, like a painting, like a gardening, even cooking can be very, very creative and de-stressing. And like photography, like, so the something creative can completely take your mind off the work. And that completely new way of using your brain, I would say. Our brain has infinite capabilities, we don't realize, we're just learning. So that can help. When you come back and join work, it will be, you are in a much more better mood, because you have seen life from a different perspective. And that perspective brings you a higher degree of maturity in your work. That is what my real, whether it has been photography, yes, it has given me so much. I have learned to look at life with such wide view, that it has given me a much more mature way of doing things in my work. So a team level plays very, very, I think I was looking for these slides. You work as a cohesive department, you get all these benefits, and co-workers help you a lot. They recognize first that something is wrong with you. And this is an ideal situation. I think the slide came out very nice, so that is why I'm sharing. So you can try and achieve this, but we are far from this in most of the hospitals in our country. And we just love hospitals where they employ you, they would like to get the maximum out of you. But then if you remember this, you can work towards it. That's all I have to say at the moment. Even we have all these things in place on paper. We show this in our audits, but when it comes to the ground reality, it's not really there. So that is what. But once again, we should not forget all these things. So another concept which I borrowed from Mayo Clinic, which I was telling you about, is esprit de corps. Esprit de corps is a French term. It means working together and being loyal as a group can give you this wellness, resilience, and contentment, which is required to balance your burnout. So this, if burnout, your life is a balance which you should maintain, and you should try and achieve this: your wellness, resilience, contentment. Three things which you go into the details. It looks like this. So this is your center zone, is where you are trying to achieve, and you need all these things. And your hobbies and vocational activities, you can see, is just a small part of it. It is a much more broader thing. So this is an ideal, but yes, this can be achieved. This is a recommendation from the Mayo Clinic, and I have a very close friend who works there as professor of medicine, and it's wonderful knowing that they have gone so much into this research. So no matter what, one should never give up. Being a physician is more than a job; it's a calling, we say. So with that calling comes a lot of works, a lot of stress, a lot of sacrifice. But just because we have chosen to answer the call doesn't mean that we must do it alone. We human beings, we have evolved by helping each other. That is why we have survived as a race, as Homo sapiens. That is why the Neanderthals did not, or the other species did not survive, because we have learned how to help each other. So remember that in the modern medical world, the system is broken. That doesn't mean that you should be broken. There will be setbacks from time to time. The better you take care of yourself, the better your patients are going to benefit. So yeah, this is Jalaluddin Rumi, 13th century poet. I love his poetry. And I say, you were born with wings, so why crawl through life? And that is one of my images which I've used. So yeah, that's all I have to say on this. Thank you very much for a very patient listening.
Thank you very much for a very insightful session. I would say it's a 3 decades of experience in a clinical practice within 30 minutes, sir. So it is very we are privileged to have words from you. And what you exactly said, the quality of doctors, either a superhero or a lone ranger, who
Yeah.
can do it, a perfectionist. I was in that situation. You just, you want to keep pushing yourself until you realize that
Right.
you are in a deep down abyss. Um, so I was doing the same, after my residency, I joined Dr. Pranjal Modi and a liver transplant unit. I worked there for 2 years,
Mm.
and then I moved to US. And you know that transplant fellowships are one of the
Toughest.
the toughest fellowship. I mean, you just they don't expect you to keep going, but they don't even say that you can take a break and come back.
Right.
You just keep on working for hours and day and night. Most of the transplant happens in the midnight, and so
Yeah.
somehow I able to finish the fellowship. And then I was thinking, yeah, I mean, I can keep on going. I can just keep on doing this kind of lifestyle that you have, irregularities in sleep, no attention on your food habits, and no family time, no vacations, and everything. So I moved to a job there, and it's the things were happening in the same way, so more tougher, I would say. You have to wake up early in the morning, let's say 5 6, go there
Yeah.
rounds, and then you start your cases, and you come, let's say 8 9, and then my kids were, I think 8 or 9 months old. They both were sleeping. You just come back, have your dinner alone,
Yeah.
sleep, and go back again. So and
So
these
much.
happened for a couple of months, and I realized, I mean, this is not sustainable. I need to find something. And that's where I took a decision to just resign from that position in US after my fellowship. Came back, took a break, recharge myself, read, whatever the stress busters we have. So spend time with family, read a lot, did some meditations and other stuff, recharge, and start again. So it's that's how I mean, so the first problem is recognizing the things that happen to you.
Yeah.
The problem is no,
Absolutely.
and even if you recognize, nobody wants to address that issue. That is the problem. So I think we'll talk more, and probably we'll do more stuff in this area. I think it's needed. It's
Right.
much needed. And the problem is at personal and system level, as you already addressed. Um, so we'll work on that. So floor is
Uh,
open for the questions. If anybody has questions, we'll take questions.
I think there is already one question from Dr. Kirit Kubawat. Yes, he is asked that whether it should be mandatory for doctors to take a certain number of leaves, especially in corporate hospitals. Yes, corporate hospitals do have a leave policy. That much leave, I think, whatever you are entitled to, you must take.
Yeah,
Whatever paid leaves you have, you must take the leave with. And I've seen doctors not taking the leaves. They
yeah,
would
yeah, yeah,
like to work and show how good they are. But take the leaves and take more if required.
yeah.
But do that family holiday. Take that leave. Even I regret at times not taking the leaves which I should have taken. So, but that is not good. So the time will
Well,
not come back. The time will not come back to do the
yeah,
things
Dr.
you
Kirit,
have
you
to
can
do in a
unmute and
particular.
ask questions or comment.
Yeah, yeah, sure.
Yeah, sir. Can you hear me?
Yes.
Yes.
Yeah. Sir, my question was slightly different. What I said is that it should be mandatory for a doctor to take leave. If they don't take a leave, they should be charged for not taking a leave.
Absolutely.
That's that's
Absolutely.
a more than ideal scenario, Dr. Kirit.
Hmm.
So, sir, do you think this, the success protect against burnout? Like, if you are successful, I mean, you just keep on going. Do you think that?
Yeah. So once again, the basic thing is not the situation, but how you react to it.
Yeah,
So if you are successful, you are more motivated, no doubt,
yeah, yeah.
and you can take in the stress. But at the same time, other things in life should not get missed out.
Hmm.
Success does not mean spending 20 hours in the hospital every day,
Yeah, yeah.
however good, however much you might be earning.
Agree.
It means doing the things which other things which help you, connecting with people.
Yeah,
Isolation at the end of the day, um, there is a saying that it's lonely at the top.
exactly.
So it is lonely at the top, and sometimes wonder whether it's worth it. Well, it's not. I would rather have good friends whom I
Yeah,
can
yeah,
connect, my family whom I can connect.
yeah,
It is lonely at the top. So success, yes, but success has different definitions.
yeah.
Just by heading a department in a big hospital or medical college, heading the department, and I will always working. That is success. For another person, success might be just okay. I'm doing some work. I'm earning whatever I need to, and I have a good family life, and I have a good life off the hospital also. That is also success.
What are the good things that will help us to get a good career and
Yeah.
keep a good lifestyle?
Yeah. See, when you are a medical student, I think the first priority must always go to do what you are meant to do, what you have come here for. If you are first year, second year in KEM, means you are perhaps one of the best intelligent students out there. And at the moment, you should focus on your studies and the residency program or whatever clinical training. But at the same time, don't get overworked. You know, don't work. I know KEM is a very, very, very busy hospital.
Yeah, yeah.
You can get just carried away. So
Yeah.
find some time. I think nowadays I've seen students, they form good friends group. They learn to chill out, and they learn to enjoy a little bit of time every day. And that, what I can suggest is what we used to do: integrate the two. Like when you meet up in the evening and go for a cup of tea or go for a chill out session, discuss what you have learned throughout the day. And in your
Mhm.
clinical years, we used to discuss the cases we saw every day, and along with that, we used to discuss other things also. So that is what I would say. And what you can do is you can plan beforehand. Keep your knowledge bank intact. What each specialty offers in medicine nowadays. So accordingly, you can develop your interest that way. And a little bit of keeping hobbies help. Being in whatever can be allowed. You can. To de-stress, you can listen to music, or maybe you can many young boys and girls nowadays, they know how to sing. You can practice because nowadays there are so many avenues where you can practice and do something, have a small instrument. Guitar is very, very popular amongst the youngsters. A little bit of chill out session every day. Call your friends to the room, have a guitar session, have a singing session. All these things, small, small things will help you to relax. So, whatever hobbies you had during your childhood days, you can try and continue that, whether it is collecting coins or collecting something or something creative like doing a sketch. I used to have a classmate who used to do brilliant sketches. I don't know why he was in the medical profession. So, and we used to tell him do some sketches, and he used to draw people, teacher teaching or whatever, and that was wonderful. And so that is how you can incorporate some of the things.
I get your
So,
point, sir. Thank you so much. I'll try to integrate it such that I can get a good career
become
of
try and
myself.
become a whole person, not just hardcore medico. Hardcore medico
Yeah.
is people outside of my profession would tell me, you doctors are very boring people. Because you can't talk of anything,
Except medicine.
except medicine. You can't, even if you meet outside, you people talk amongst yourself, you don't mix around and ask anything what is going on in the country to what is something good about photography or some other thing or any topic. The doctors can't talk, so they are very, very, very boring people. So don't
guess
become a
we
boring
pretty much
person.
discussed, we pretty much discussed what is written in maybe Harrison or Robbins just to
Yeah.
understand the disease much better.
Exactly. So
Yes.
try and become an interesting person. That will keep you motivated. So
Yes,
wherever
yes.
you go, even outside your medical friend, you should be the most interesting person in the room.
And Stefan, understand that it's not a 1 year, 2 year, 3 year, or 4 year journey. It's going to be a 15-year journey before you become a practitioner.
Yeah.
And it's not the end of the story if you become practitioners. I mean, and even after that, there is other stressors that unidentified stressors comes, when you start practice. So it's a long journey. So you have to save your energy and then balance your life from start. Okay, so I think we'll conclude the session, sir. Any closing remarks from your side?
Our life is a very precious gift.
Yeah.
And that has a limited lifespan, I would say. So we have to make full use of it. And not only it is important to be successful in our career, success has various definitions, but it's also important to be happy about it. So that is what we are meant to be. And our external circumstances are getting difficult by the day due to local, regional, national, international, to climate, everything. So future is not going to be easy. So we need to be aware and to be prepared and keep our happiness level intact. And that is what I would say. And for that, the concepts which I told you today, these are tools to be kept in place, to be used, and to work towards that. And mental health is very important. India is once again one of the worst places for young people for mental health. Thanks to the situation, we all know. So that that is the situation. But we need to gear up for that. And everything, I always tell my juniors that it's all in the mind.
Exactly.
Whatever is not in the mind will not happen in your life. So all this, the concepts, if it is there in the mind, immediately you will have an alarm setting up that yes, something is going wrong. I need to react differently. Sometimes you lose your temper. You think, no, it's not correct. Let me think and let me react differently. So these small ways which you can alter your reaction to the situation around you can make you a happier person, adjusted person, successful person.
I agree, sir. So I agree with you. And as a doctors and practitioners, I think we should think beyond practice. The life is also, there is a life also beyond practice. I mean, as you told, like when you are done with your work, I mean, there should not be any work at home. Spend some time with family, have vacations, cultivate hobbies, and experience different life. I mean, it's not about spending day and night in hospitals. And this is how it become. Like if you are in the field for years, You
Yeah,
think, you tend to
become
think that this is life, there is nothing else. And if you are at home, na, I have seen people, my friends, those who are busy people, if they are home for one day, na, they don't know what to do. Like they, and
yeah,
exactly, they're boring people. They just sit, they
exactly.
don't know, they are confused, they don't know what to
Hmm.
do, for this day. So I think we should plan the day out, all the things that we should be doing.
Yeah.
Thank you very much, Dr. Das.
Thank you very My
And
pleasure. My pleasure.